So I remember quite a lot of years ago, it was the very first time that I went to a conference, and I came back and I'd learned for the first time, I had a lecture on central sensitization, similar, not as fancy as what I told you, because at that stage we only understood really little snippets. And I was so excited. And I came back to my practice, rubbing my hands in glee. I was a family practitioner, general practitioner at that stage. And so I sat down and I had on my list, as we all do, I had somewhere on my list, I had somebody who was significantly sensitized. And this guy was a particularly gloomy individual. He came in and we were, he was pretty worn down. So I said, look, I've just been to this fantastic conference, and I launched into explaining, I did drawings about nerves and synapses and stuff, and I was in the middle of drawing this, and I looked up, and he wasn't quite like this guy. He had his arms folded, he was leaning back, his eyes were narrowed, and he said, so you think it's all in my head, don't you? And actually, you think it's all in my head. The translation for that is, you think I'm making it up. You think my pain isn't real. So now, I can't tell you, this is a catastrophe. If you want to actually carry on and have a decent therapeutic relationship with somebody, and they think that you believe that they're just making it up, that it's just not real pain, you're lost. And unfortunately, this was my very first experience, and this was, our therapeutic relationship never recovered. It was just, he went off eventually to see somebody else. I just couldn't salvage it. So this was, this is kind of painful for him and painful for me. Painful for him because his pain continued. Painful for me because it was actually quite a horrible experience as a health practitioner. So I don't want this to happen to you. And really, again, this is what we're talking about here, is how to make sure, as much as you can, that this kind of horrible thing doesn't happen. So during the rest of this training, we're going to look at 3 crucial conversations that you have to have with a patient, chronic pain patient, especially, of course, a chronic pain patient who is sensitized, central sensitization. And the first is this, I love this picture, on the left, the elephant in the room. So you all, I'm sure you all understand, but this concept where you're all working, you're all in the room, you're interacting, but in truth, there's this enormous presence. There's this vast presence sitting in the room, and everybody in there is trying to ignore it, or is so blind and stupid that they cannot actually perceive it's there. And in this case, the elephant in the room is that this person has central sensitization. This 15 to 20% of the world who have central sensitization driving their pain. And so the first crucial conversation that you have with your patient is actually recognizing whether that huge looming presence is there. Recognizing and asking the right questions and having the right mindset that you recognize that this person has central sensitization, because that changes absolutely everything. That's the first crucial conversation. The second, which is over here, is the paradigm shift, which is that once you, as the practitioner, are aware of the fact that this person is sensitized, how do you explain this to your patient? Because this is really, really crucial and tricky. So what I've got here is a wonderful picture of where everything's level, but everything isn't as it seems. And that's really what you're wanting to do, is you're wanting to impart to the patient that everything they've believed about their pain is actually not true, or lots of things they've believed about their pain is not true, and actually there's something else happening, which is they've never thought of, but which this is the most important part of their pain. And it's something that the tests that were done, that were there in black and white, the explanation from the very important doctor who saw them, it's something that's different from that stuff. And it actually is the primary reason why they're continuing to feel pain. So it's a paradigm shift. They have to see the world, perceive the world and their body differently from what they ever did before. And the third crucial conversation is that's once that's on board, what do you do then? The journey when your patient gets their life back, basically, from chronic pain. And to do this, they need to understand that they need to take action. And if you get the process wrong, if you miss one of these steps, you can't jump from step 1 to step 3. Just doesn't work. So if you miss a step, at best you're going to get a confused patient, and at worst you're going to get this kind of patient that I had, who's angry, pissed off, doesn't think, you think that they think you don't believe them, and they will move on.